Let's now focus on the UK, where the number of coronavirus cases has been falling, but the number of people in hospital remains high, as does UK's daily death numbers. UK is combating the new variant of coronavirus that is not only more infectious, but also maybe more deadly. And that is something that the authorities there have indicated. Well, to talk more about the situation and how they're handling it, we're joined now by Professor Devi Sridhar, Professor and Chair of Global Public Health, the University of Edinburgh. Thank you so much for joining us. Now, the UK is going through this terrible crisis. You know, we're watching it from here. It's under another lockdown. Several measures have also been taken to curb the spread of the disease. What has the impact been of all these measures?
Starting to kind of stabilize the numbers, so they're starting to flatten, but they're not really coming down as fast as we'd hoped. And unfortunately, a lot of the hospitalizations and the deaths we're seeing are baked in. These are from infections from several weeks ago. So the hope is that we can avert deaths in February and March, but it's not going to help us now in January.
And what about the vaccination drive? What have been the major challenges? Is it going smoothly now?
Well, it's going pretty well. I mean, right now there's, I think, almost 5 million people who have been vaccinated. They're starting with the over 80s and the over 70s, care home workers, healthcare workers. So it's been, I think, really a bright spot in the pandemic. One of the challenges is supply, just getting enough vaccine and making sure that they can get them out to people quick enough.
And so is it a race that we're seeing to vaccinate people faster and get ahead of this infection spread?
Exactly. Right now, it's a race, especially for those in elderly groups and vulnerable groups, because we know if they can get the vaccine, this could prevent severe illness and prevent them getting very ill and dying. And so right now, it's racing to do that before these people become infected. And that's why there's been such a huge push to get people into clinics on the weekends, in the evenings, at all hours, just to get, as many people protected as quickly as possible.
And what about the health services? We see lots of reports of health services being overburdened.
So it's variable across the country. So London and the southeast of the country has been hit pretty hard. And so hospitals there have had to cancel, routine surgeries, routine care to make space for COVID patients, have had to expand ICU beds to make sure they're more available, have had to get more oxygen in to make sure everyone gets it. So the health pressure has been intense in those parts of the country. Luckily in Scotland, where I am, it hasn't gotten to that point yet. They brought in restrictions earlier. But healthcare workers are also exhausted. I mean, they've been doing this for months. It's a year now almost that they have been working around the clock. So I think burnout and exhaustion of healthcare staff is going to be a huge issue for the coming months.
And UK has also announced strict fines for those who violate the lockdown, huge fines, in fact, and for big gatherings. So have people been, violating the lockdown?
Well, I wouldn't blame it only on people. I mean, the messaging has been confusing. So first, we were told by the government last year that this was a very serious virus. Then they were told it's not serious, go into restaurants, go back to your normal life, because they wanted the economy to go and people to go back to the normal life. And then when the healthcare pressure comes, they try to scare people again, saying you need to stay home. And I think for a lot of people, either they have to go to work, they need to earn, which is fair enough. They have financial reasons, or they're just tired of being under restrictions now for a year. So it's a really hard one. I think it's hard to blame people because this has been going on a long time, and especially for those who need every day to go out and work, self-employed people in small firms, they'd rather get to work and make money and risk getting COVID than stay home and lose their income.
And speaking of COVID fatigue, is there any indication when this lockdown will end? And also there needs to be a firm policy, isn't it, rather than have a haphazard one regarding lockdowns and the kind of messaging that is given out?
Well, I think the two things is first in, March, April, we could ease restrictions. I don't think we're going to go from lockdown to no lockdown. I think it's more going to be an easing of how much flexibility and how much things are open, like a dial going up or down. So we're hopefully going to see that, restrictions being lifted in March, April. But the real challenge now in Britain is we have a new variant that is spreading very quickly. And how do we protect against other variants like in South Africa or Brazil? Or Nigeria that could come into the country and spread quickly. So I think that's the next challenge, is not only getting the vaccinations out, lifting the restrictions, but also thinking how do we protect against new variants, which could be like a whole new virus and starting again.
All right, Professor Sridhar, thank you so much for joining us again on the show.